The American Heart Association has issued new guidelines for CPR in the event of an adult who's had a sudden collapse. The vast majority of these cases involve people who have a cardiac event, not a respiratory problem. So they've done away with rescue breathing, or what's commonly known as mouth-to-mouth resuscitation. So the important thing to remember, if you're with somebody who has this sudden collapse, especially an adult, you first call 911. If you have a cell phone, call 911 before you start. The only thing you'll be doing now is the chest compression. So call 911, or if you're with someone, have them call 911. The chest compressions are done at a pace of 100 per minute until help gets there. And the technique is very simple. You want to find the spot right here on the sternum. This is called the xiphoid process. You want to move up about 2 fingers and mark it with your hand like this. Put your other hand over top, be in a straight line this way here, lock those arms out, and pump straight through the chest, through the heart. Dr. Michael Sayre, who was a professor of emergency medicine at Ohio State University and who headed up this committee, said basically call 911 and start pressing on the chest as hard as you, as fast as you can, or to the basically to the pace of 100 pushes per minute. The reason for that is the heart and lungs contain oxygen, and especially if you're with that person who's collapsed, there's enough oxygen in the system. The most important thing is to put the pressure on the chest, which helps the heart pump. The pressure down actually pumps the heart and pumps the blood flow through the system to keep oxygen going to the important organs, and hopefully help will arrive in time for either a defibrillator or a professional that can take over. There's no more mouth-to-mouth necessary for adults who pass out in this sudden situation. In the case of children who do this, you still need to use rescue breathing because usually it's a respiratory issue. With adults who have suffered near drowning, an overdose of either drugs or alcohol, or like carbon monoxide poisoning where oxygen is not available, you still need to do the rescue breathing technique. But for the vast majority of people, the chest compressions is all we need to do, which will help more people get involved, because quite frankly, and even the experts recognize this, there's what's called the yuck factor, where people are hesitant to give mouth-to-mouth to people they're not familiar with, or even with people they are familiar with. So it's called Hands-Only CPR. Check into it and keep reading my piece here, which will give you some more details. But Hands-Only CPR, the new guidelines by the American Heart Association. And the most important thing too is, one of the medical professionals involved in this study said doing something is better than doing nothing. So if someone's in dire straits, the chest compressions, 100 per minute, can save life. All right? Thanks a lot.